Hi everyone. Today we are going to deal with the second class of health psychology. The previous class we have tried to give an outline or definitions of health psychology, the branch of psychology that is health psychology, and we have discussed how the health psychologist works, how they works in this field. So today we are going to deal with the next topic, that is what is the need and significance of health psychology. Okay, when we are starting the need and significance of health psychology, we have to mention what factors led to the development of health psychology. And it is given here that since the inception of the field of psychology in the early 20th century, psychologists have made important contributions to health, developing models that explore how and why some people get ill and others do not, how people adjust to their health conditions, and what factors lead people to practice health behaviors. In response, these are the some questions uh, which exist with the people. And in response to these trends, the American Psychological Association created a task force in 1973 to focus on psychology's potential role in the health research. So, participants included counseling, clinical, and rehabilitation psychologists, many of whom were already employed in health settings. So, independently, the social psychologist or developmental psychologist and community or environmental psychologists were developing conceptual approaches for exploring the health issues. So, these two groups joined forces in 1978, and the division of health psychology was formed within the division of health psychology was formed within the American Psychological Association. And it is safe to say that health psychology is one of the most important developments within the field of psychology in the past 50 years or 60 years. So, from the 1980s, the field gained momentum so that in 2001, the American Psychological Association added promoting health to its mission statement. So, later it was not there, and it is added along with the American Psychological Association, that is within the name of promoting health. So, this is the area how there is a chance to what are the need, there is a way to need to develop the branch of health psychologists. So, there are the other factors have also uh, fueled the growing field of health psychology that we'll discuss one by one. What are the other factors which lead into or which give a support to the growing of field of health psychology? Yes, the first one is the changing patterns of illness. So, an important factor influencing the rise of health psychology has been the change in the illness pattern that has occurred in the United States and other technologically advanced societies in that decades. So, here the until the 20th century, the major causes of illness and death in the United States were acute disorders, especially like tuberculosis, pneumonia, and other infectious diseases. The prevalence of acute infectious disorders such as tuberculosis or some measles has been declined because of treatment innovations treatment innovations and changes in the public health standards, such as the improvements in waste control and sewage. This is the uh, treatment innovation that have been done, that is, and protect the public health standard, or they made changes in the public health standards. The acute disorders are the short-term illness, often the results of a viral or bacterial invader, and usually amenable to cure. Yes, the other one is the chronic illness. Now, the chronic illness diseases are the main contributors to disability and death, particularly in industrialized countries, especially the chronic illness like especially the heart disease and cancer and some of the respiratory diseases. These are the main contributors to disability and health, particularly in the industrialized countries. So, chronic illness are slowly developing disease with which people live for many years, and that typically cannot be cured but rather are managed by patient and healthcare providers. So that we know that it some it will not lead into death in very sudden, but it will exist with that person until he dies. So it will be within that person, and that should be controlled, and they have to develop the better standards with that, along with that, live along with that chronic illnesses. Yes, this is the area, that is, chronic illness is the area that have to get more consideration from the health researchers or health psychologists, or from the medical side. So that is why it gives more importance that chronic illness are disease in which psychological and social factors are implicated as causes. So people have, or the physicians or people or clinicians, they have understood that. So it is a disease that psychological and social factors are also implicated as the causes in that. For example, the personal health habits such as diet and smoking contribute to the development of heart disease and cancer, and sexual activity is critical to the likelihood of developing AIDS. So these are the some of the diseases. These are the some of the areas that we can understand it is happening just because of the personal health habits. So taken that it as a health issues, or the making them standard in their health area, or developing their health controls. People may live with chronic disease for many years, therefore psychological issues arise in their management. So as we said before, it will not make the death easier, or even after getting into this disease it may not be, but the person have to live with that problem or with that disease for many of the years, and within this time the psychological issues has been will be erased, and they have to follow the management methods. So adjust psychologically and psychologically and socially to their changing health state and treatment regimes. So that is, they have to adjust with, they have to psychologically, they have to prepare, and socially to changing their health state, because maybe day by day the health pattern or the health will be changing, and they have to cope up with, again they have to cope up with the treatment methods it is being arranged for that. So that is an issue. So people have to, or the deceased person have to adjust with the situation, both psychologically and socially. So chronic illness affect family functioning, including relationship with the partner or the children. That is very clear that even after getting into such a chronic illness, there will be it will affect the family functioning, and also some of the relationship within the partner or within the children also. So will be they cannot be included with the along with that. So chronic illness may require medication use and self monitoring of symptoms, as well as changes in behavior, such as altering diet and getting exercise. Health psychologists develop interventions to help people learn these regimens and promote adherence to them. The other factor is the advances in technology and research. So, new medical technologies and scientific advances create issues that can be addressed by health psychologists. Just in a few, just in the past few years, genes have been uncovered that contribute to many diseases, include breast cancer. How do we help a college student whose mother has just been diagnosed with breast cancer come to terms with her risk? If she tests positive for a breast cancer gene, how will this change her life? Health psychology help answer such questions. So this is the concept why health psychologists have been addressed here. And certain treatments that prolong life may severely compromise the quality of life. So increasingly, patients are asked their preferences regarding life sustaining measures, and they may require counseling in these matters. These are just a few examples, and these are some of the few examples of how health psychologists respond to the scientific developments. That is, certain situations or certain treatments that prolong life may severely compromise the quality of life. So these are one of the factors that been affected with the or people will addressing by the health psychologist. Yes, the another reason for the development of health psychology is the increasing medical acceptance of health psychologists within the medical community. Health psychologists have been developed a variety of short-term behavioral interventions to address health-related problems, including managing pain, modifying bad health habits such as smoking, and managing the side effects of treatments. Techniques that may take a few hours to teach can produce years of benefit. That is, diet or smoking. These are some of the things, some of the areas that can be exist with a long period. It will take a few hours to teach, and it can produce a years of benefit to the person. Sometimes it may completely, they may avoid the smoking and they may keep up with the diets. So such interventions, particularly those that target risk factors such as dieting or smoking, have contributed to the actual decline in the incidence of some diseases, especially the coronary heart disease. And taking some other example, that is, psychologists learned many years ago that informing patients fully about the procedures and sensation involved in unpleasant medical procedures such as surgery improves their adjustment to those procedures. So if we produce or if you give the information related to the unpleasant medical procedures like surgery to improve their adjustment to those procedures. As a consequence of these studies, many hospital and other treatment centers now routinely prepare patients for such procedures only. Thus, ultimately, if a health related discipline is to flourish, it must demonstrate a strong track record not only as a research field but as a basis for interventions as well. That is why the health psychologist is very well on its way to fulfilling the both the tasks. So they will be preparing some of the procedures to be healthy within the patients and to the clients, and they have developed a better treatment areas. So to avoid some other uh, major uh, treatments like surgery or something else, so they will be giving the knowledge, or they will make some behavioral interventions to address such health problems, and they will modify the bad habits with the persons, that is like avoiding the smoking, and they will understand, they will give the side effects of the treatments, which will be moving into the upgrade level. And the remaining area that we will be discussed in the next class or the upcoming slides.